We started off today's session going over the anatomy of what we found in the evaluation, which was a strained Teres Minor leading to overcompensation of the scalenes. We also moved into an Adson's test, which showed diminished radial pulse leading to what we suspect is thoracic outlet syndrome. He also had a positive hornblower sign, which was further indication that Teres Minor was weak. And we did some modalities such as cupping and ultrasound and shock wave, but the real problem is weakness of the Teres Minor. So this is just me doing some muscle stripping of the scalene muscles, which we suspect is leading to the radiculopathy. And as the picture shows here, you can see that scar tissue is what happens when our body has excessive tightness or weakness over tissue over time. And this gua sha, or instrument-assisted soft tissue massage, is to work on these scalene muscles where we suspect the peripheral nerve entrapment is coming from. Now, this is just a ERT, or active release technique, of the scalenes, which I want you to do at home. And this is a picture showing where he's feeling his radiculopathy. It's important to note that he had gone to his chiropractor for several months, but no one identified the soft tissue as the problem. They just kept cracking his neck. He does have tightness of the C1 and C2 vertebrae from the tightness of the scalenes, so this is just some mobilization with movement to help with rotation. In addition, he has some tightness and hypomobility of the C7 vertebrae, so some downglides there. He fit all the criteria for manipulation, so we did do a C1, C2 manipulation here. It felt really good. He also has some hypermobility or anterior subluxation of the shoulder, which means that we need to strengthen the shoulder. We started off today's exercises by just some rotational stretches. This is a snag stretch to work the suboccipitals. He also has some C7 hypomobility, so this is just mobilization with movement on his own. You can also use the Thoracic, the transverse process, to get some mobility, some lacrosse ball work to get some blood flow to the tight muscle. He didn't have any problems with reaching overhead and external rotation, so he started by working this motion to warm up the muscles. However, he did have pain with Teres Minor activation, so a lot more difficult in this position. And again, here's the photo of the muscle that he strained. So he does have poor scapulohumeral rhythm, so we worked on proper arthrokinematics of the shoulder by depressing the scapula and then going into flexion and abduction to hit that Teres Minor muscle. Again, just making sure the arm slides up the wall. So the next exercise is probably the most difficult, but to focus on that Teres Minor, we go into this frontal plane with external rotation while reaching overhead. So this is the injury that seems to be the most difficult. This is just an upper trap stretch. So again, anchoring the arm. And probably the most important exercise is a weak muscle, is a tight muscle. So this is me just showing him how to do lateral deviation isometrics. Reach out with any questions. Till next time, aloha.